Hello, everybody, and welcome to the ALS United Mid-Atlantic Goals podcast. My name is Tony Heil, and I am the Executive Director here at ALS United Mid-Atlantic, and we serve people with ALS in Pennsylvania, New Jersey, and Delaware. If you've listened to our podcast over the past year or so, we've had over 50 episodes. We have shared different perspectives when it comes to ALS. That includes people who are living with ALS today, people who are caregivers, our nurses and social workers, researchers, and people who have some other connection to our mission, including people outside of the ALS community, like in Parkinson's or Huntington's disease, where we share our mutual connection to advocating for more science funding in general and for caregiving as well. Today, I'm excited to talk to another member of our greater ALS United community. In the past, I've talked to people from ALS Network, from other places that are connected with us here through ALS United, including I have talked with someone from this organization before, from ALS Arizona, and we're going to talk about what our mutual similarities are, how we can learn from each other, and what it means to have our direct connection to patients. So today, I am excited to welcome Taryn Norley. She is the president and CEO, not president or CEO, president and CEO of ALS Arizona. She's helping to teach me about how I can do my job better, how I can identify with our patients better, and hopefully she can learn from us as well. Taryn is overseeing a very complicated state because there's so many different communities, so much diversity and needs for the ALS community there, but it's all about connection. So Taryn, thank you so much for talking today.
Yeah, thank you. Thanks for having me on, Tony.
So first of all, when did you first become involved with ALS Arizona?
Yeah, back in 2011, I've always worked in nonprofit, and I was working at another organization for arthritis, and both my supervisor and my boss had shown me the job description for ALS and said, hey, you should check this out. It seems like it would be a good career growth for you. And they didn't know it, but a little earlier, we had thought my grandmother possibly had ALS, and so she was experiencing some of the symptoms. She had drop foot and just seeing some other things. So her doctor had thought they would look into that. It ended up not being ALS, but we had a little bit of that thought in the beginning, with her possibly being diagnosed. And then during college, I had read Tuesdays with Morrie, and the book really resonated with me. And I thought, oh my gosh, what is ALS? What can we do to help people that have ALS? And so it kind of grew from both of those experiences that I had a true interest in ALS. And I was pleased to learn that ALS Arizona, just the services that this organization provided at the time, and then we've grown so much it'll be 15 years in October here, but just love what we can do. And yeah, that's kind of how it all fell into place for me.
Yeah, I just talked with Cassie Adams from ALS Northwest, and one of the questions I asked her that I'd like to ask you is, when you joined ALS Arizona, what surprised you most either about ALS or about what services were provided from your organization?
You know what surprised me a lot, and I mentioned that I came from arthritis, and arthritis in people it's a much larger group that's affected. And so we had a lot of different funding opportunities. We had huge pharmaceutical support. We had a lot of backing, but ALS being a little bit more on the rare side and just a smaller disease and less people affected in Arizona with it, I was shocked and kind of, it raised a lot of awareness in me, and the lack of drugs that we had, the lack of investment from pharmaceutical companies. So that was a huge wake-up call to me, just coming from arthritis and moving in here.
Yeah, I think that it seems like such a need, and it's also really hard to do the research because the disease is different from one person to another. Obviously, you said you'd come from arthritis. What have you learned about how challenging ALS research can be?
I think it's the investment, the cost alone. They talk about $1 billion to bring a drug to market, right? That's a huge investment. Getting companies to be able to invest. I've had contacts who were in companies, and I would ask them, do you have anything going on for ALS? And one at a big group told me, we have nothing in R&D going on for it. So for me, that's pretty hard hit to take when you're dealing with people and looking forward to what can we do to help them. And so again, like I mentioned before, a huge wake-up call brought in, which I know is very dear to your heart, is advocacy. What can we do to get these companies more involved, to get people to want to invest into ALS, to invest into our research? That's something that is kind of sitting with me and where I'm thinking what we need to do, to kind of move forward.
Yeah, and so when it comes to advocacy, were you involved in that from the start? Because I know that advocacy's grown and evolved so much since we both started in 2011.
It has. And yes, right from the beginning, we did a lot more federally. So in the state of Arizona, we had not done a lot local with our state legislation. We are starting to. We started a couple of years ago, understanding the importance, but we had focused a lot more on federal. And at the time when I started, we had 5 staff. So to look at that too, trying to figure out who's going to help oversee that. I know your organization is much, much larger and you guys have a longer history. We started in 91. We had 5 staff when I started. So really, who was going to take that on? And so I did take it on just because our other staff were either serving our families or doing the fundraising. So I saw that as an area, but again, I could only do very much federally. And so now a few years ago, we started looking more at the state level, understanding your success, looking at what you have done with your state. And we want to do that as well. And so we have started to focus on that. Last year we had our first state advocacy day, and it was good. We kept getting pushed, as sometimes happens with things going on with your local legislation. We kept getting pushed, so we got pushed to a later date, not exactly where we wanted, the end of May. So not a lot of members were still around, and a lot of people got to hear it. We still pushed forward with the day, made it as successful as we could, but understanding that this past year we came back, moved our day into March. Huge success. We had a lot of people join us. We had a representative do a proclamation. She read a proclamation for ALS Awareness Day on the floor. We were able to highlight 3 people living with ALS within the state. And so that all happened in there. And then we held a luncheon after that where we had 15 members RSVP, and actually 9 were able to make it in there because there was a lot of voting going on. So some weren't able to pop over there. Their staff made it over there to grab a lunch and to introduce themselves, but it was really successful for us to be that kind of true first effort out of the gate to get things going. We also had pushed forward, as you're probably familiar with, the Medigap bill. And so we were really pushing that this year. Sadly, we didn't make it onto the agenda to get voted on. We did have a unanimous vote in the House for the Health and Human Services Committee to get it to move forward, but we just couldn't get on the agenda for the full House and full Senate to vote on it. But guess what? We're back. We will be back this next year. So we're already figuring that out. We hopefully have a sponsor already signed on. So a lot of things moving. And that's kind of where we're at right now with advocacy.
Well, it takes lots of effort. I mean, we started smaller and grew, and that happens everywhere. It's all about finding allies who have a connection to ALS. And if you're listening now, you can find our recent podcast with State Representative Kyle Mullins about his personal connection to ALS and the power of advocacy. But I'll take it to Delaware because that's a much smaller state than, well, most states, including Pennsylvania and Arizona. And I remember going there for an ALS day and found that like 3 legislators spoke up impromptu about a connection. So I bet when you go to meet with people, you're probably very surprised sometimes, whether it's a legislator or a sponsor or someone in the media, how many people, especially lately, seem to either have a family or other personal connection to this disease.
You're absolutely correct. We will find it in, sometimes it's a staffer in the office, right? Or the person who actually answers the phone. And then at our own state lunch that we had, a couple of the members did come up to me and say, I had a dear friend who had ALS. And so we're like, oh, there's that instant connection. And they're like, I will help you. What do you need? Just let me know.
So another thing that we have in common, advocacy wise or mission wise, is Pennsylvania. Really, all of our region here for ALS United Mid Atlantic. We have some cities like Philadelphia, but a lot of rural counties and communities. And when I've spoken with others from Arizona, I know that that is a tough issue as well. I talked with Janie Dalrymple from your organization last year, and she said getting certain things throughout Arizona, it's a big state, like physically. So, is that something that you have been prepared for? How do you address providing equitable care across different communities in Arizona?
Yeah, that's a great question, and something we're always trying to do better with. But we do, one of the services that we will provide is transportation. And so we will help cover costs for people to get to medical appointments, to get to their neurologist or their clinic appointment. We've also included that for our events if they would like to come out. We know how important it is to be connected and to engage with others. So should they want that, we've provided transportation. There are lots of things we're looking at. I don't know if you've ever talked about this with some of your clinics, and something we're still thinking about. I mean, this is still in just thought process, but is there a mobile clinic that we could provide, where we could take our clinicians up to these rural areas? And it's not the consistent services that we would love to provide, but there may be that opportunity to provide some type of service for them in an area where we could draw on that area to come in and see a neurologist, see a team. I think that would be really great to offer. We just have to figure that out. And I know two of my neurologists are in it, being Arizona. They're both interested in summer months going up north where it can be a little cooler. So that was kind of fun little statement that they shared. They go, "Hey, I'd take July if you want me to."
I bet. Speaking of events, we did just have Lou Gehrig Day. It's a national thing now with MLB. We have had a long-standing relationship with the Philadelphia Phillies going back 40 plus years, and you have a long-standing baseball relationship as well with ALS Arizona. Tell us about how baseball impacts ALS Arizona.
Yeah, we are so fortunate. We have the Arizona Diamondbacks in our community, and they have been here for 30 years, and they have given over, I think they said over 100 million to the community. And so very philanthropic, probably the best professional team to give back in Arizona. And they have always partnered with us. We have always had some type of partnership where either we've attended the game, thrown out the first pitch, and then a few years ago when MLB did designate the official Lou Gehrig Day, they've continued that on, and they've always donated items to our gala and our event for us to use to help raise funds. This year, they gave us over 300 tickets for families to attend the game, including one of the I think the largest suite was there. So we were able to get 75 people into a suite together, which makes it so nice because we could accommodate 9 wheelchairs in there. So, it's kind of fun to watch the game together. So we had that. And then in addition to that, they recognized 15 of our people living with ALS on the field, and then we had the first pitch thrown out. Actually, they had 2 ALS patients throw out the first pitch, and then we had an individual read the Lou Gehrig speech, and then offer another patient to be the manager for the game and exchange the lineup cards. So that's kind of a fun experience, and lots of press. We were on to raise a lot more awareness. We had a few channels do interviews with the individuals who were either throwing out the pitch or being the manager. And just, we love that day to have that many people together. In addition to us, we have our other peer organizations there with us. And so even more people there to raise awareness for ALS and to join them. But I will say, I think the Diamondbacks gave out over 750, almost 800 tickets to ALS groups. So they're very giving, and we love the support. And we were also fortunate enough, and I'll have to get this video for you, but the Diamondbacks, they agreed to take the Ice Bucket Challenge. And Derek Hall, who is the GM, he was out of town, but we were able to get the manager, Tori Lavello, who he came on and he took the challenge. He said, no problem, let me do it. I'd love to do it. And interestingly enough, we asked him, because we will see him throughout the season wearing the shirt that says End ALS. And we're like, Tori, what is your connection? And he was able to share that he was with the Red Sox when Ice Bucket Challenge was out, and he knew Pete Frates. And so he talked about the connection with Pete, how he knew Pete, and he knows Nancy and the family, and just how much they mean to him. So he said, I will do whatever it takes to support ALS. He also mentioned Sarah Lang, who's with MLB, that he mentioned her too, that he has a great relationship with her, and so he would love to support the two of them. And so that's why he continues to do this. But yeah, just I can't say enough great things about the Diamondbacks and how much they care about the ALS community.
Well, that's really fantastic. And I imagine, though, that a lot of the reason that they stay connected with you is not just that they have those personal connections and awareness of ALS and all that MLB's doing, but you've earned trust along the way. If you're not doing anything for ALS, why would they give you the tickets and do the fundraising and things? So I imagine that whether it's the Diamondbacks or other sponsors, you're able to show them the actual impact of your work in the community in Arizona.
Yeah, we work really hard. And I think something that our vendors, and I'm sure you probably see this too, is the way they'll give the money, right? They want to support the activities, have their name on a few things, but they actually come out and help, right? They volunteer. They are at our events. They want to help and they want to be with our families. We also try to do events where we're not just fundraising, where we're just gathering together. We had, for the end of the year, we had a baseball game and adapted rec. You know, we have adapted tools that we can use. We have a field. It's called the Miracle League here in Scottsdale. And we are able to use their field, and it's all wheelchair accessible. And so the wheelchairs go on the field, they round the bases. If the individual can't hit, somebody will hit for them, and then they can just drive and hit the bases. But it's a really fun activity. But some of our sponsors will come out and join us on those days. They come to the different activities. So I really think it helps create a family atmosphere, and it just really connects us because, as you know, with ALS, it affects the entire family. It affects everything we do. But once you see it, you want to help. That's what I feel like. I feel like you want to help these individuals, these families. I'm like, what can I do to help someone going through that diagnosis?
Yeah, it makes such an impact. I think that we have people who remember ALS from someone that's passed away or that they've met, because it's a disease that you can't forget if it's someone in your family or your neighborhood. Nothing against other diseases. It's not a competition, but it's just all encompassing. And one thing I know with how pervasive the disease is for a family, what all it does, that means that there's so many things you can do for an ALS family, including caregivers, respite care, all sorts of things. How do you manage addressing the needs of the ALS community and patients while making sure you have the capacity to do it? Because if we had 10 million, not 10, if we had $20 million this year for just ALS United Mid-Atlantic, we could spend that. We could do things with, I'm sure you could too, but you don't have that. Unless you do, in which case, if you could share, that'd be great. So how do you manage the needs you'd like to meet with the capacity that you have?
Ooh, it's hard. You know, we always
Yep.
have that kind of dream budget that's there. So basic needs first, right? We want to get to all of those and to have the staff meeting, our families, the equipment, our core program. I know that's kind of what we want to loan out, our equipment loan, and then adding in what we can. Thankfully, we've been fortunate. We broke 2 million this last year. And again, we serve about 600 patients. So we have services. We have a lot of very giving individuals that give back to us because we currently do not have any state funding. We do not have any federal funding. So it is truly raised majority from individuals. But we just work to really care for each dollar and make sure that it's spent in the right way and that we are investing in our families. We've had a couple of great foundations donate to us significant gifts that help provide those services. And I think it's just important that we're very good stewards of each dollar and making sure we stretch each dollar and make it work to what our families need. One way that I do think we're a little bit unique in the services that we provide, we also have a rec therapist on staff. And so we will offer a lot of quality of life programming. We went skiing this last year. We took, I believe it was about 7 individuals with ALS and their family downhill skiing. Yes, we have snow in Arizona. I know people don't believe it, but we do have snow up north. And they love the idea to go skiing, getting to be up on that mountain again. A lot of them had skied. Some, it was the first time they skied. We had one person who was over 80 who went with us. And
Oh, wow.
it's just incredible to see that. So we really love our quality of life programs. We've done that. We've done horseback riding. We do water skiing and water rafting, getting pulled behind a boat. Just amazing to see. And that one, if you want to do that, Tony, be ready, because the underwriter questioned me. He goes, "You're going to do what with ALS patients?" And I go, yeah, we're going to go skiing and we're going to go water skiing and water rafting. So it just took a little minute to get that insurance, but completely worth it to see these smiles, to see people who used to ski, who used to be on the water, be able to do that again. And we really got interested in these quality of life programs. We had a wife, her husband had ALS, and it was at a support group. And she's like, my husband's just really, he's depressed. He doesn't want to do anything because he feels like he can't do anything. And it was to one of our recreational therapists. And she said, "What would he want to do?" And she said, "Oh, I think if I could get him golfing just one more time, it would change everything." And Amy looked at him and said, "Why can't we go golfing?" And so she and Andy are both rec therapists, and they figured it out, collaborated with a group. We started the golf. So we do also have golf when we can get that scheduled. But yeah, made all the difference. The other very cool thing we do is fishing. And I don't know if you've ever seen these rods where you can bite on them and they will reel in. For you. They're pretty pricey. I think the fishing pole is about $850, but we had a foundation step up because they loved fishing. The president of the foundation loved fishing, and he's like, "We should go fishing." And so I'm like, "We should." So we've done that as well. But those programs are really powerful, and I think they're a little bit different than what other ALS groups provide. So we really like to be able to do that, to continue people doing what they want to do, even with an ALS diagnosis.
I think that's what's exciting about being part of the ALS United network is I can talk to any of our ALS United members, like I said, Cassie, or I talk to Sherry from ALS Network, or yourself, and there's a whole new thing I can learn. It's just like a cool idea, because we have a group that does fishing, that does fundraising, so maybe I should reach out to them and see if they want to do adaptive fishing and have someone join. I imagine they'd say yes, but you don't even think to ask until someone like you brings that idea up, either on a call or a bigger meeting.
I think that's it. And that's where I learned the most, right? Is from our ALS United partners and just hearing everything they're doing. And we were so fortunate. I think I mentioned to you that we had our gala this past weekend, Bite Night Gala, but Julie and Sarah came out from ALS United Chicago and they joined us. And so it's just nice to have that support, and we really did put them to work. So if they are listening, thank you, Julie and Sarah. We engaged them into flower center pieces. So anyway, we're always looking for help, but I love the way we can lean on our partners.
You didn't invite me. I don't know. Maybe I would have had a reason to go. So
I will invite you. Let's get you out here next year. Well, I'm trying to move it to April, so that's a beautiful time. You probably will want to come in April.
I wish I had more reason to go to these areas because I don't have any reason to go to Colorado, and I'd like to be a reason to go to Colorado or Arizona or Oregon, and just like, oh, there's an excuse, I gotta go, but I rarely get the chance. But so tell me about your gala because we did talk about that a little bit before we started recording. What was the big theme of the gala? Like, are there things that people left there as like, oh, this is the memory they're going to have from this event?
Yeah, I think so. Our theme this year, and it was the 17th annual Bite Night event. So, what Bite Night is it's a foodie competition. We had this year, oddly enough, we should have pushed this a little bit more now that I'm talking to you. It's year 17. We had 17 restaurants and catering groups competing for the best bite of the night. And their big prize that they all love to win, that all the chefs want to win, is a giant fork. And so it's something they get to put up in their kitchen. But we have everything from higher end steak places, and this is what I love. I love a high-low engagement opportunity. So we have expensive steak houses competing against Whataburger. I don't know if you have Whataburger. Do you not have Whataburger? Okay.
No, we don't, but I know what it is.
Okay, anyway, out west we have Whataburger, and then Portillo's, because our friends from Chicago, we had two Chicago's place restaurants, Portillo's and Lou Malnati's. So we had both of them in there, and then just some really nice catering groups, but they all compete to win that best bite, and we let our guests vote on who's going to win that. So we have that. We have mystery boxes. I don't know if you guys do mystery boxes where you put like a certain value inside a box, and we sell them for $50. You are at our event, you're guaranteed at least a $50 value. Sometimes you might get like a total wine tasting for 20, airline tickets. There's just different fun things we put in there. So those, we had about 400 of those, and they're at $50 each, and they always sell out super fast. So if you do not grab them when you walk through the door, you probably are not getting one. I don't think I shared, but we have about 600 people that attend this gala, and it was a great night. And then we do our typical silent auction. And then within the event, we have a live auction, and we have the best, we call her the auction-tainer, Letitia Fry. Some of you may have seen her across the country. She does a bazillion auctions throughout the year, but she is the auction-tainer because she's very entertaining. So we had some really great live auction items. Probably the highlight of our live auction was we have a very, very generous donor here in Arizona who lends us his private jet. And so it's him with 10 other people. He and his wife go, and then 10 other people. And then he has a suite at SoFi Stadium in LA. And so he sends over, our group go, and you get to ride on his plane. You get to be in his suite. They provide all the food and drink for you, and you get to enjoy the game. And the best part for our donors is you are back at home in your own bed that night. So they come back that night. But it's a really generous gift, and this year that gift went for $50,000. So we're really
Wow.
I know, it was such a fun evening.
So I'm guessing you didn't win that auction for yourself personally.
Did not, but we do it in a smart way. They sell them by seats, so that's how they split it up. So couples were in for I think 10,000 each to get those, but still cumulative 50,000. So that was a really fun item. And then we always have a speaker. So our person living with ALS who we highlighted this year was Ernie Reese. And he is amazing. I will send that out as well because just his message and phenomenal job. He wove in just the vulnerability of living with ALS, but he included such humor and just love through his family. And he had the room laughing, then he had us crying. And he is a veteran who's done 3 combat tours in Afghanistan. And I think he's 45 or 46. Ernie, if you're listening, I'm sorry if I missed that. Hopefully get that. But he's around that age, mid-40s, has a beautiful wife and 3 children. So hearing about his service and what he's done, and then about his family, he spoke. And one of the lines that stood out to all of us, because he had us laughing and crying, he said, "They told me if I make you cry, I raise more money." Or no, they told me if I cry, I raise more money. So Good stuff. But yeah, so Ernie spoke, and then we do the typical paddle raise after that. And so we were very fortunate this year to have a couple of tribute gifts there. We had one for 30,000 in memorial of a very loved family, and then we had another one in 25,000. So all really generous and wonderful people that, again, the theme of the night was celebrating community and hope. And that's really what I feel that we have done here to bring together. And you've probably done it with your group too. The ALS community is strong, right? They are supportive. We are there for one another. And so it was really that evening. And then all together, we were able to raise just over 600,000. So that's our best year yet. And we're thrilled with the results.
That's amazing. Congratulations. And it's not just about the dollars, it's about what those dollars do. So as we finish here today with this podcast, what is the most important thing, or the most important things, plural, that you're able to do for the ALS community in Arizona when people support your mission?
We are able to help our families, right? We love to support each and every one of the family members because we do know that ALS affects the entire family. And you've probably had this too, where you have the person diagnosed with ALS and we have care for them, but they've said to me, who's going to take care of my family? Who's going to take care of my wife? And so that's really what we've worked to do, to be there for everyone. We just had a caregiver retreat in May where we had, again, a foundation help cover that for us. I think you guys do this as well. But we did an overnight at one of the resorts here. And so we brought in, I think we had 18 sign up caregivers that came up, and we did sound bath and yoga for them to start off. And then they all, and they could choose to come with us, or they could choose to stay in their hotel room and just get a good night's sleep, right? And just have some quiet, be by themselves, and not have anybody asking them for anything. And so some went to dinner, and then the next morning, we had arranged for spa treatments for them. They could choose between a massage, pedicure, different things. And then we did a cabana by the pool where they had their own kind of setup there. But the feedback that we received from that overnight was just incredible. Some of our families said, one caregiver told us, I have not slept for 7 hours straight in I don't remember how long, but to be there was wonderful. To have my own bed was wonderful. To eat a hot meal was wonderful. So I think it's really about being able to help different people because, for our caregivers, we need to make sure that they are filled and healthy and can keep going to take care of the person living with ALS. So I think that retreat opportunity really helped with that. So again, these funds that we're raising, these things that we're doing, all go back to our families, to our services that we provide. And so now we're looking at a way from this retreat, how can we do it for the entire family? And we've had weekend retreats for our families before, but we're talking about separate tracks where the caregivers can be together, but yet have their own opportunity, where the people living with ALS can connect with others and they have their own opportunity, right? And then we've got the kids, because we want everybody to have a good night away, from their home, but to be together. So that's kind of where we're at right now, figuring out what that's going to look like this next year and how we get more people involved. So I think for us, it's being able to provide our staff. Home visits for us mean everything. Getting able to get one of our care services staff members into a home to be there, because at clinic, sometimes there's a lot going on and we know that can be a very long day. But what we do is we meet with them at the clinic, but then we say, let us schedule a home visit. We want to come and see you at your home. We want you to have as much time as you want to ask those questions, to get services that you need. Maybe we forgot to ask something at the clinic. Maybe you need something more. We can engage our experts. So while I say we have 9 staff, we have our care services staff, we have development staff, and then admin staff. In addition to that, we contract certain positions. So you mentioned Janie, she is our nurse. She does a fantastic job, truly knows ALS. We contract work with her. We have 2 respiratory therapists who we contract with. We have a SLP, speech pathologist that we contract with. And then we have 2 nurses now. Amy, who used to work for us in care services, she went back, got her nursing degree, and now is over doing research with, which we didn't get to yet, and I'll just go quickly, with Dr. Scheffner and Dr. Bowser too. So here in Arizona, because we have Barrow Neurological Institute, I am very fortunate to have Dr. Jeremy Scheffner and then Dr. Robert Bowser both on my board. And so we just have a great, wonderful research component and just a lot of great research going on in the state of Arizona. I'm not sure if you knew this, but a couple years ago they received the largest NIH grant of $16.9 million at Barrow for ALS research. So that was Dr. Bowser and Dr. Scheffner both received that. So there is a lot going on over at Barrow where they're at. And then I am so fortunate to have Dr. Robert Bowser as my board chair. So he came into that last year and he's just been wonderful. And so we are really looking at a lot of research opportunities. And one of our highlights is this year we are going to be able to invest in into more research. And so we are looking to do that with one of them. And that's something new for us. I mean, we've always given to research, but this year we will have oh my gosh, it's escaping me, but we will have research available for the state of Arizona, funded by ALS Arizona.
That's great because it's not just some money going to research, it's empowering people with ALS to be part of research. And, as you're talking, it reminds me that you said that you serve 600 people with ALS. Really, you could easily triple that with how many caregivers and family members, like you said, looking after children. So you're easily looking at 1,800 more in terms of who you have some sort of service and guidance for. I think all of us in nonprofits and an ALS world in particular undersell the impact of what we're doing. It's just, and then you look at it and you're like, oh no, wow, we're doing all this stuff that I never even got a chance to account for. So I really appreciate all you're doing there. I'm going to steal all of your ideas, but I'll give you credit along the way.
I'm thinking yours. I'm thinking we fly you out. I talked to Suzanne. We got to get you out here in the West, Tony. But you should talk about advocacy to us because you are the king of advocacy.
Well, the only reason I'm a king of anything is to cover up the shiny spot on my head to wear a crown. So that's the only reason for that. I think we all have our skills, and the reason why advocacy is effective is by sharing those personal stories and connections, which obviously you guys are very good at as well because you are connected with your patient families. They're not going to donate if you just give us money. You're not going to advocate and volunteer if you say just show up. It's because I think everyone at our organizations really feels that personal connection. And it's not a competition there. Like if you're working in the ALS world, I think that you're doing important work and you're connecting that way. But if people want to connect with you, if they want to learn more about ALS Arizona, where should they go to learn more? What's the website or social media where they can go and connect with you and maybe ask questions or connect a family member or more?
Yeah, alsaz.org is our website. And then all of our social media is ALS Arizona. And yeah, we welcome anyone. If you have a loved one or a friend or someone with ALS who's in Arizona, just reminding them that we are here and that we want to help. So that's really helpful. And I do get a lot of snowbirds. So we do get some people from your area coming out here for the winters and from other places.
And I know that from all over the country, we'll find someone who maybe have left our area for the summer or for the winter, or they're in our area for a little bit, and because we can communicate, we can help each other along the way. So please learn more from Taryn and from ALS Arizona. I learned a lot from talking with Taryn, Cassie, Sherry, others who are in our ALS United network. If you want to learn more about our work, it's alsmidatlantic.org and also on social media at ALS Mid-Atlantic. And please go back and find past episodes on our YouTube, Spotify, and iTunes. If you want to email me to be a guest or to suggest some guests or leave a comment, my email is tony@alsmidatlantic.org. It is not something hidden or private. You're always ready and willing and able to connect with us with your ideas. So thank you so much, Taryn. I look forward to what we're going to continue to do when we collaborate together to serve our ALS community.